Welcome to the Fear and Greed Business Interview. I'm Sean Aylmer. We talk about technology quite a lot on Fear and Greed, but the stories I like most are the ones about companies using technology to make a difference. I think this one falls into that category. Volpara Health Technologies is an ASX-listed company that says it has a simple purpose: to save families from cancer. The technology is used by healthcare providers around the world to understand cancer risk and uses AI to improve medical imaging, particularly when it comes to detecting breast cancer. Terry Thomas is the Chief Executive Officer of Volpara Health. Terry, welcome to Fear and Greed.
Thank you.
So tell me about the technology. What exactly does Volpara do?
I'm glad that you asked, because sometimes people are a little bit confused if they go for a mammogram and they see these big machines and they don't see Volpara's name on it. They wonder, well, what in the world does Volpara do to save families from cancer? So breast cancer is our focus, although we cover other types of cancer, and we are a technology company. We don't create any machinery. We don't produce any hardware. We are strict technology. However, we use technology in three different main areas. The first area is identifying who is at risk of developing breast and other cancers. A lot of people think that breast cancer is heavily hereditary, and in some cases, about 10%, it is, but many cases, there are lots of other factors that determine someone's odds of getting cancer. So we have several different algorithms, and we harvest information from electronic medical records or from our portal and calculate out someone's lifetime risk of carrying genes that might predispose them to cancer or other kinds of ways that they might be at risk for cancer. The second main thing we do is we manage a whole lot about the operations in a mammography center. So managing getting the patient into the room, what the technologist puts in about the patient, gathering the information from the machinery, the PACS systems, together with our AI, assessing the quality of the images when someone gets a mammogram, which many people don't know is actually a type of X-ray, and serving that information in a comprehensive way and a quick way for a radiologist to be able to then report back to the primary care doctor or the referring physician the results of that mammogram. By the way, we also automate a whole lot of reporting in a very highly regulated area. So we save a lot of time by pulling together information and sending it to the governing bodies. But the other big area is related to breast density. So we apply our AI on the images of a mammogram. We assess everything about that image. Was it done correctly? Was the compression done right? Was the machinery working right? Was it positioned right? And then we actually analyze at a 3D level the tissue of that breast to calculate an objective measurement of the density of that breast. Very fatty breasts, low density. You can't tell by looking at it or squeezing it, but you can tell from looking at a mammogram. Those are lower risk of cancer, but also much easier to find cancer on those types of breasts. Whereas very dense breasts show up on a mammogram as almost white or lots of gray. That can hide cancer, but it's also a risk factor. In fact, the most significant risk factor for breast cancer. So that's what we do.
Okay, there's a lot in all that. A few things I want to focus on. One is the fact that you obviously work with a lot of third parties or stakeholders, how that goes. The second is in terms of the mammograms and the use of technology to, I think I'm right in saying it, Terry, to better improve results effectively. But let's come to that in a moment. How do you work? I mean, I remember someone asking Alan Greenspan many years ago, the former US Federal Reserve, how they're ever going to solve the health crisis and the blowout in costs. And he said technology will do it. His point being, if you can get kind of health providers to work together and use technology, you can make huge leaps forward. That's kind of what you're trying to do, but from a disparate group of people.
Yes. It's interesting. I, as CEO, love to spend time with customers. And as much as I can, many of our customers are in the United States, most of them. And whenever I go to the US, I make sure to visit as many customers as possible. And 100% of our customers tell me, this is a consistent answer. When I say, what's your biggest problem? They all say time. We don't have enough time to be able to catch up from COVID, to get all of the women through. We don't have enough radiologists to read all of the images. We don't have enough technologists. So we really, really struggle with time. So as a technology company, leveraging AI, leveraging ways to speed up workflows, the key thing for us is, can we free up time to allow a radiologist to focus on what they're trained to do, which is look at the natty, scary images in the middle? And can we reduce the administrative overhead so that people can use their precious time to be able to get those patients through? So for us, that's why we exist.
I suppose my question is, are the providers all happy to share their information with you?
They are. They are. Now, you asked about partnerships as well. We work with all of the mammography manufacturers. There are 38 of them out there.
Mm-hmm.
And we actually ingest their images. We work with Microsoft. Azure is our base. And so we upload those images and analyze those images and provide insights. And again, I don't think they would be willing to do it if, number one, we weren't providing value. But number two, a big differentiator for us is a very, very strong information security infrastructure. So we pass some very, very rigorous security standards, and that creates enough trust that our customers will enable us to be really a partner with them in the room.
Stay with me, Terry. We'll be back in a minute. I'm speaking to Terry Thomas, CEO of Volpara Health Technologies. Okay, what about artificial intelligence? You've mentioned it a couple of times and the use of AI. How far has the technology come in recent years, and will it go in the next couple of years because of this revolution, for want of a better term, in AI?
I think revolution is absolutely the spot on correct term. And I think we've just begun to scratch the surface of what we can do with AI. And Volpara does some amazing things right now, but I'm quite excited about the future. As I mentioned, I just came back from meeting at Microsoft, and the theme for sure from Satya Nadella was AI is where Microsoft is putting their bets. He actually shared that AI will create 100 trillion GDP in terms of the impact of where this is going. We've worked with Microsoft side by side with some of their engineers on developing new AI algorithms. For example, many people don't know, when you get a mammogram and we're looking for cancer, when you do the deep image analysis that we do, we can actually look at each of the arteries that feeds the heart. And the coronary arteries, when they get calcium building up on the sides, that's actually a risk factor for heart disease. And heart disease, heart attacks in particular, kill far more women than breast cancer and oftentimes strike without warning. A lot of women don't realize that they've actually got problems with their heart as they go about their daily business until they have a heart attack. So for us, leveraging the power of AI and that analysis of those images to actually, as a byproduct of watching for cancer, to send someone to the cardiologist and potentially alert them that they might need to go on a statin or some other preventative situation so they don't have a heart attack, is one example of new AI. But there will be so many more speeding up workflows with generative AI, going through and figuring out what most likely is going to be the analysis of this image for a radiologist to simply review and approve versus generate themselves. It's speeding things up in every other industry, and healthcare will be no different.
Okay. You mentioned Microsoft, and you've been there recently. You recently won the Microsoft Global Healthcare and Life Sciences Award, thousands of nominations from about 100 countries. Nice work, Terry. What's it mean for you?
Boy, I was delighted and surprised to actually be invited to present about Volpara live at their Inspire conference just before Satya Nadella did his keynote. And so at one level, that was beautiful exposure for a company that's known within the mammography circles, but in many cases in healthcare outside of mammography, an unknown name. And in fact, I didn't know about Volpara 3 years ago. because it's it focuses on this one area. But as a company, we are breaking out of mammography. We do cover other areas besides breast. We cover other cancers besides breast cancer. We've got a grant from New Zealand Trade and Enterprise to do some modeling of expanding to employers, to insurers. We want to get every woman starting at age 25 to understand her own personal risk of cancer, breast, and others, and have a personal plan to prevent cancer instead of just early detection. So the relationship with Microsoft and the awards gave us some nice exposure. However, we do look forward to working with them as a partner on new models, and even things like bringing risk into Australia.
Okay. We're sort of running out of time, but I just mean your view on the outlook for Volpara. The US government recently, the Food and Drug Administration, made it mandatory to notify women of their breast density. Does that change the outlook for you guys?
There are numerous tailwinds that are great for us. That's one of them. And, it does validate the work that we do in the United States, but it's also something that people are looking at internationally. So we noticed that shortly after the FDA ruling, IMED in Australia made their stance that they will inform women in Australia of their breast density. And we're looking at, I'm going to be spending the month of September in Europe. There's a lot of buzz within Europe, country by country. Will they follow suit with what they're doing in the United States? But that actually comes together with the United States Preventative Services Task Force, who's now suggesting that people get mammograms at age 40 instead of age 50. The American College of Radiology publishing new guidelines asking for risk assessment starting at age 25. And the National Accreditation Program for Breast Centers in the US actually requiring for accreditation that a risk assessment be done on all of their women. So when you add these things up, and I'm going to put it together with one thing that shocked me on my last trip, which is another national 10-time Emmy Award winner, Jill Martin. She's a journalist, opened up last week to the nation about her breast cancer diagnosis, but with a message about each woman needs to understand her risk and ideally get genetic testing early. These things are really strong supports for us to continue our growth and continuing our march to profitability.
Terry, thank you for talking to Fear and Greed.
You're welcome.
That was Terry Thomas, Chief Executive Officer of Volpara Health Technologies. This is the Fear and Greed Business Interview. Join us every morning for the full episode of Fear and Greed, Australia's best business podcast. I'm Sean Aylmer. Enjoy your day.